uncertain times, it becomes more important than ever to strengthen the industrial base and reinforce our national defense capabilities. These are just a few instances of AFRL's nationwide response to COVID-19. At Wright-Patterson Air Force Base in Ohio, the epidemiology lab is testing and processing samples of COVID-19 sent from military treatment facilities around the world, nested in AFRL's 711th Human Performance Wing. The United States Air Force School of Aerospace Medicine, USAF-SAM, is working closely with public health officials across the Department of Defense and with the Centers for Disease Control and Prevention. At Joint Base in Charleston, South Carolina, USAF-SAM medical professionals are training medics on the use of the Transport Isolation System, an infectious disease containment unit that minimizes risk and exposure to aircrew and medical attendants as they transport patients aboard military cargo aircraft. Meanwhile, AFRL-developed jump kits are supporting critical operations across the Department of Defense and the intelligence community. With businesses and organizations recalibrating day-to-day operations, the Secure View Program Office based out of AFRL's Information Directorate in Rome, New York, is deploying technology that provides remote operators with secure access to classified networks. Under an agreement with the University of Cincinnati, AFRL's 711th Human Performance Wing is supporting a first-of-its-kind clinical trial involving closed-loop control, oxygenation during mechanical ventilation. This technology is of great interest since it could reduce the time healthcare workers spend with COVID-19 patients adjusting ventilator settings. As the host center for this trial, UC is partnering with hospitals across the country. Back at Wright-Patterson Air Force Base, the USAF School of Aerospace Medicine, the Air Force Material Command's only training schoolhouse for medical training, has implemented public health safety measures to protect students attending in-residence classes. Protective measures include twice daily screenings, an increased focus on cleanliness, and reduced class sizes to allow for social distancing. In Rome, New York, AFRL's small business office is connecting hospitals and medical facilities in need of protective gear with able manufacturing firms by leveraging their network of industry and government contacts. Without a manufacturing line, facilities in New York and Connecticut risked running out of critical protective gear. Colonel Michael Zadakis, an ear, nose, and throat surgeon in AFRL's 711th Human Performance Wing, provided frontline observations and recommendations regarding early symptoms of COVID-19 in an article published online. Zadakis reports that the sudden onset of difficulty with smell or taste with no other nasal congestion or other symptoms could cause healthcare providers to exercise increased caution. Aimed at strengthening the COVID-19 diagnostic criteria for healthcare providers, the article offers recommendations for those treating, testing, and diagnosing patients. Supercomputers at AFRL's Defense Department Shared Resource Center in Ohio are evaluating the effectiveness of various COVID-19 countermeasures and reducing the spread of the virus. Through computational fluid dynamics, the High Performance Computing Modernization Program is assessing which methods are best for reducing airborne transition to aircrews and medical attendants in the event of airlifting COVID-19 patients. Ultimately, the info generated by the supercomputers will enable mission planners to control the movement of air droplets and best mitigate risks to airmen.